Guys, as you can tell from the title of this video, this is about my recent health diagnosis with a large adnexal mass, and I thought, I should do this video because it might help some people who are facing a similar problem and are looking for information, which is exactly what I did. So I thought, YouTube is so resourceful. When you get a new diagnosis, all you do is, well, what I did is, most people do that, I'm sure, is go on the internet looking for information, and it's so confusing because you are so overwhelmed with all kinds of things and you don't even know which one it is, which one to pick, what to do. So I thought I should do a little video about my experience. So I will start with how it all started. So about 2 weeks ago, I got a water infection. How did I know that? Well, I'm a woman. I know when I have a water infection. You know when something isn't right. And this is not something that happens quite often. So I knew exactly that something was right down there. I had the urge to go to the loo. I didn't have any difficulty passing urine. I just had a full bladder all the time. So I thought, oh, this is a bit of a weird water infection. Usually it hurts when you pee and all that stuff, but not this time. So I did a urine sample, took it to the doctors. I said, guys, please test this. I don't need an appointment. I just need the doctors to tell me if I've got water infection. So they did exactly just that. And the same day they called me and said, all right, the doctor has done a prescription for you. You just need to come and collect it. I went and got it. Started the course of antibiotics, finished it. Something weird started happening in my bladder. I was having this severe pain. I started having the most excruciating pain you can think of. I mean, I have got sickle cell, so my pain threshold is quite high. I don't easily feel pain, except it's quite bad. And when I say bad, it's usually a stabbing, like double-edged sword being pierced and turning round. That is sickle cell pain, and that is the kind of pain I will complain about. But this was a bit strange. It was painful, no doubt, quite uncomfortable, but I wasn't sure what exactly it was. The pain each day was getting worse. It will get better sometimes, and then it starts again. It was coming all the way to my lower back, all the way to my left thigh, going down to my leg, and I thought, this is rather strange. And then I started feeling a bit of bloatedness. I thought, this isn't a normal water infection, is it? So I called the doctors again. I said, guys, can you please test my urine again? I'm bringing another sample. I need you to check if this thing is still there. I am having some really strange symptoms. Did another sample, took it to the doctors. They said, oh no, it's all good. It's just some trace. So just keep drinking loads of water. I'm sure it will all clear. That was me, loads and loads. And I tell you, more than 2 liters of water a day I was pouring down. But this pain wasn't getting any better. So at this point in time, I wasn't sure exactly what to do. I called the doctor. I said, guys, I need to see somebody. This pain isn't getting better, and I need something to be done about this. So I managed to get an appointment after arguing with the receptionist. So went in, saw the doctor, examined it, physical examination. Wow, that's a bit of a strange pain. We're going to order some blood tests and just to make sure that everything's okay. Right, just keep taking, drinking loads of water and taking some paracetamol, which is what I was doing. So got back. This is about, I would say, about a week after I'd presented with the initial symptoms, and I'd finished, by this time I had already finished the course of antibiotics for the water infection. So did another water sample. There's still a trace of leukocytes. So doctor says, just keep drinking plenty. I'm sure you're going to wash it off in the next few days. But the pain was just getting worse. So I thought, all right, I need to do something about this. I checked myself into A&E. Well, I called 111 and they sent me to A&E. Went to A&E, same thing, did a water sample. No, it's just trace of leukocyte. We can't see anything. Did an ultrasound. Yeah. And an ultrasound said, oh, your kidney looks a bit big, and I think you should get in touch with your doctor. Maybe you need to see, you need to be given a CT scan or something like that, or get in touch with your specialist doctor. So another course of antibiotics, and then more paracetamol. So I kept doing that, which I normally do not like to take antibiotics except it is absolutely necessary, but I kept taking it anyway. But this pain wasn't getting anywhere, and I said to my husband, this is so strange. I'm taking all these antibiotics. It's meant to be getting better. It is meant to be getting better, but it was just getting worse. By this time, this is about 2 weeks after, and I couldn't do anything. I couldn't sleep at night. I couldn't eat. I couldn't stand. I couldn't sit. I couldn't do my work. It was just taking over my life. And the bloatedness was out of this world. I mean, usually I have a fairly flat tummy, I would say. But for the past 2 weeks, this is my tummy. And I just couldn't get it down because the bloatedness was something else. So on Friday, just 2 days before my birthday, I decided that I've had enough with this back and forth. I need somebody to tell me exactly what is going on. So I live quite far away from my usual hospital. When I say usual, my consultant, so I live with sickle cell, like I mentioned earlier. So my sickle cell consultants are in a different hospital in Birmingham. I don't live in Birmingham. So I had to take a taxi and go to, well, there is a new hospital now, that's where they are, the Midland Metropolitan University Hospital, which looks quite nice. So I checked myself into A&E, and I said, we need to get down to the bottom of this, because at this point in time, I could not take this anymore. I couldn't even drive. I couldn't sit in the car because I felt like my kidney was coming out. It was that painful. I couldn't even touch it. It was so sore. So walked into A&E, said, I am in severe pain. I need to see the doctor. They, took my details within about 10 minutes. Luckily, I didn't have to wait too long. I saw the triage nurse who took some examination. My blood pressure and all the other things were quite low. So this was a bit strange. I mean, this is common for when I am in pain. Usually when I'm in pain, my blood pressure is usually very, very low. My SATs, my oxygen level was quite low, and this was a bit of a concern. So they got me to see the doctor straight away because the pain was getting quite bad. So doctor came to see me. I described the pain, said, are you sure this is not a sickle cell pain? Listen, I know sometimes I'm trying not to get angry saying this, because every time we present with pain that isn't sickle cell, you kept being asked this question, are you sure this is not a sickle cell pain? Well, if you live with a chronic illness that you've lived with for the rest of your life, you will know exactly when it's not that pain. So I was getting quite frustrated with this question. Everyone asking me, it sounds to me like a sickle cell pain. Dude, I am the one with the pain, and I am telling you this is not sickle cell pain. I feel like my kidney is coming out. I am in agony. So I don't know if it's kidney stones at this time. I said to the doctor, could we do something about this? Could we do a scan? I need to know what this is because it's been going on for too long. I just gave them a whole history of what's been happening in the past few weeks. Doctor said, okay, we're going to get down to the bottom of this. ordered for a CT scan. I went in and had a CT scan. At this point in time, they decided that I was going to be admitted. 2 days before my birthday, I was already so angry because I knew at this point in time I might not be going home. Doctors came back after the scan had been done. I thought it was kidney stones. All right, let's, just get the diagnosis and then get some treatment. Well, I am sorry to tell you that this isn't kidney stones, madam. CT scan has found a large adnexal mass in your left ovary. What is that? I had absolutely no idea. I'd never heard of this before. I'm like, can you speak English, doctor? Because by this time, I was already in panic mode. I was so scared, so anxious, like all I could hear is that there is a mass in my ovary and I wanted it out. I said to the doctor, can we take it out? It's like, hold on, calm down. And the doctors went on and on and on. I don't think I was even listening to what they were saying. Things were just going through my head. My husband is at home. My 2 babies are at home. I just want to go and see them. I've got a mass. I need it out of my body as soon as. They said, okay. And I said, my birthday is on Sunday. Yeah, listen, you've got bigger problems than your birthday. You've got to calm down. By this time, I said, okay, I need to listen to what the doctors are saying. So the CT scan has shown a mass of 10 centimeters and it's quite big, and it's putting pressure on my liver, which showed on the blood tests the kidney function wasn't quite good, and the scan also showed that my liver is quite enlarged, obviously because of the pressure from the mass, and my liver, my kidney was quite enlarged, I said that, and my liver is being pushed, and my colon and all that, and oh my goodness, I need this thing out. And the doctor said, well, they can't really take it out without knowing exactly what it is. So they're going to order for a transvaginal scan so we can give them a bit more detail of what they are looking at. So I had to spend the whole weekend in hospital. Unfortunately, it was a Friday, and of course, in the NHS, in the UK, not much is being done in the weekend. So I had to spend my birthday in the hospital, but I couldn't be sent home because I was having temperature every now and then. I was having a fever. So I was put on antibiotics throughout the weekend, IV antibiotics and loads of fluid. So yeah, I had to spend my birthday in the hospital, but I got lots of loved, messages, and my family visited me and all that stuff. But obviously it wasn't where I wanted to be. So I had to wait for Monday to get a proper diagnosis of what this is and to know what are the next steps, which I was quite anxious. So there is me sitting in my hospital bed, thinking about all the things that I could think of, getting so anxious. So yeah, and then Monday came. I've just been looking at the time. It's 7 o'clock, it's 8 o'clock, it's 9 o'clock. When are the doctors doing their rounds? I just need to know what is happening. By this time I was in pain, in and out of pain, just managing it with paracetamol, because that was the only thing that works. Normally when we are in sickle cell pain or crisis, we get to have things like dihydromorphine, codeine, dihydrocodeine, or morphine. No, none of those things worked, and I did not want them anyway, because the side effects, it's video for another day. So paracetamol was doing the magic. So finally the doctors came around and said, all right, I think we're going to order an ultrasound. Yes, we already said that. So we're waiting for me to do an ultrasound scan. But in the meantime, we're going to do a blood test called CA125. So this is a blood test that will determine the number of cancer cells in your system. And oh my God, the C word, I just started panicking again, started looking for stuff on the internet. I just couldn't wait to have this scan. And I was watching all these videos and I thought, you know, I need to calm down, because whatever this is, I have to be ready for it, because stress is the last thing I want right now. And stress on its own come with all kinds of, complications, which I do not want. I have already so much on my plate. I've got to take a deep breath in and absorb all this information that I have been giving and just wait for this scan. So at some point during the day, I was asked to go and have an ultrasound scan. And so unfortunately, they can't tell me exactly what this mass is. So I have to go and do further tests to determine exactly what this mass is. So I'm trying so hard not to panic, because I know at the back of my mind everything is going to be okay. So I've done lots of blood tests to test for all kinds of tumor markers, and I am anxiously waiting to get this diagnosis. And I thought, I'm sure there's so many women out there who might be in a similar situation, not knowing what to do. There is so much information out there on YouTube. Just calm your nerves, watch other people's experiences. This is my experience. If you've got any questions, please leave a comment below. And this was the main reason for me doing this video, because you know what, as women, our bodies are changing by the minute. All these hormones going left and right. There's lots of things happening in our body that we do not even understand. But I will tell you that from the minute you notice anything strange whatsoever, I highly recommend you go and check with your doctor. Because I was just pushing things off. Oh, well, this is, just my period pain. Usually when I'm on my period, I get this really bad pain, and this only started within the last few years, which I think that was probably a sign, because I usually don't get that much pain during my period. That is something to look out for. If anything changes, if anything is out of the ordinary, there's no harm in checking. The least you can get is that there's nothing happening. Do a blood test, get a scan done. I know that sometimes can be a bit challenging with the waiting list and all that, but just get it checked. Start doing something about it. So at this point in time, I am just waiting to know what this is. But I'm sure that everything is going to be fine. And whatever it is, we're going to face it. And if you are that woman that is going through something similar or even worse, you will face it. Don't let your faith down. Don't let it beat you. Because us women, we are tougher than we think. So many women are facing this, and not enough women are talking about it. Leave a comment below if you have faced something or are facing something similar. Please like, share and subscribe to my channel to know a bit more about what this is. And share with anyone who is facing something similar, or to other women who need to know a bit more about this. So this is just part 1 of this video. Once I know exactly what is going on, I will come back with part 2 and tell you what is the next plan of action. Thank you so much for watching, and keep being happy, keep being you. If you have faced any symptoms, any strange symptoms, please reach out and see a doctor. Thank you.